Welcome to the clinic. I'm Dr. McCullough, and the purpose of this tape is education. Most of you have come to the clinic and you're looking for an alternative in medicine, and we provide that here. We provide probably the best alternative scientifically based medicine in the area, and I want you to understand exactly what we're doing so you will understand why we run certain tests, why we do certain things, and you'll understand your treatment. But more important than anything else, I want you to understand the philosophy of what we're trying to do, particularly in comparison to what you already understand, which is orthodox medicine. I am a chiropractic internist. I am a standard chiropractor. I also have an additional degree in internal diagnosis and preventive medicine, and we do things in the clinic that are much more expanded than a typical chiropractic office, and we use natural substances and natural treatments to help you gain health. What I would like to do is, since many of you have never been to a chiropractor before and you don't understand the scope of practice and the breadth of what we can do in natural medicine, and in this clinic that's what we concentrate on, is natural medicine. I would like to review with you the basic education requirements of a doctor of chiropractic, and then I'll expound a little bit more on what I did also. If you look at this first slide, first let me say that all chiropractic doctors have to have a pre-med degree, just as medical doctors or osteopathic doctors do, and then they go to chiropractic college. Chiropractic college is 5 academic years long, the same as medical school. And if you'll take a look at this slide here, you'll see this is a comparison between Baylor College of Medicine and Texas Chiropractic College. And it's broken up. You can see the very top of it says Basic Science Curriculum, a comparison. And BCOM is Baylor College of Medicine, and TCC is Texas Chiropractic College. And you can go down the list there. Anatomy, 206 for Baylor, and 465 for TCC. Biochemistry, you can see those numbers there. Physiology, pathophysiology, pathology, which is a study of diseases, and neurosciences. And you can compare those for yourself. And basically what it comes out to is a medical doctor has about 1,200 hours worth of basic sciences, and a chiropractic doctor about 1,400 hours of basic sciences. We all take a basic science test on a national level, then we go on to the second half of our schooling, which is clinical sciences. You see that on the bottom of the slide. And you can see there on the left-hand side, under Baylor College of Medicine, you just have little dots. You don't have any hours like we have over on our side, and that is because at this point the medical doctors go straight to the hospital and they do rounds at the hospital like you see on TV, and they study surgery and they study different medications and the different procedures they do in the hospital. We go to the hospitals also. I served an internship at Herman Hospital here in Houston in orthopedics and neurosurgery. But we also have classes, we have our own clinics, and we do rounds in doctors' offices. And as you may see students here in the clinic occasionally with me, and they're from the college. But if you'll see the bottom line, it says total weeks required for a degree and license in the state of Texas, 150 weeks for a medical doctor and 150 weeks for a chiropractic doctor. They're basically the same. At this point, both medical doctors and chiropractic doctors can go into practice, and that's what most chiropractic doctors do. I went back to school and got a diplomate in internal diagnosis, which is a family practice type designation, and I have the designation of the chiropractic internist, and this is why we do as many tests as we do in this office. The difference between a medical internist and a chiropractic internist is I do most of my treatment with natural therapies instead of pharmacological drugs. Okay, I want you to know this because when you have friends or relatives that you refer to the office, or you tell that you're coming here for a problem other than a back or neck, sometimes people are confused. And I want you to have a full understanding that the education is equal to medicine, and that we do other things besides just treat neck and backs. What I want to do right now is I want to explain to you the difference between orthodox medicine and natural medicine, which we practice in this clinic. I want you to take a look at the board here, and you see here I have orthodox here and natural medicine here, and I want to make a comparison between the two. The name for orthodox medicine is allopathic medicine. And if we break this word down, this means opposite, and this means disease. So in allopathic medicine, we first need to diagnose a disease process, and then we give you a treatment, a drug or a surgery or some type of treatment that is opposite of the symptoms of the disease. We're all very familiar with this. We're very familiar with allopathic medicine. We see this on television every day. And there's some things that's very, very important. Allopathic medicine does wonderful things in certain areas. For example, if one of your symptoms is after a car wreck, you're bleeding all over the highway, you surely want to do the opposite of bleeding all over the highway, and that is stop the bleeding. So allopathic medicine is very appropriate in this situation. The same may go for an infectious disease process where you're beyond the point of self-repair and you may be dying from a bacterial infection. You want to do the opposite, and that would be to kill the bacteria. So allopathic medicine, we're all familiar with. The problem is in functional problems, which is what I specialize in, which is 85% of the problems that people have. In other words, functional problems are when you're able to function in life. For example, you can get out of bed, you can eat, you can walk, you can talk, but you just don't feel well. Allopathic medicine does not find a disease process yet in cases, so they don't have any treatment for it. So we end up treating rounds and rounds and rounds of symptoms. In other words, if you have a headache, a symptom of a headache, it's not an aspirin deficiency or a Tylenol deficiency. It's a symptom that your body's telling you something is dysfunctional in the body. This is where natural medicine comes into play. Now let's look on the board over here. What natural medicine does, it actually starts where allopathic or orthodox medicine ends. We start with the disease process or a condition, and we'll put that right here, and we break this down into its component parts. All conditions or diseases have many, many things that make these conditions up. And in natural medicine, what we do is instead of just treating something with symptoms, for example, like chronic fatigue may be the diagnosis up here in medicine. In natural medicine, we go below that into the function of the body. This is function. And we start analyzing everything in the body to see if it is normal or not normal. We may look at the nutritional status that you have. Is it normal? Is it not normal? We may look at your structure. We start looking at things like maybe the chemistry. Is the chemistry correct? We also start looking at things that are supposed to be in the body that are not there, things that are in the body that need to come out. For example, like toxic substances. And I have a lot of studies that show that we're getting more environmental problems more and more each day. And we do this for every physiological function that we go through in this clinic. In our clinic, we do about 300 different tests on every patient because we're not looking for a disease to name and give you a treatment for a symptom. We are looking for dysfunction in the body. This is a critical, critical point. We must, in order to get you well in natural medicine, we must find the cause of your problem. And when we do find the cause of your problem and we correct it, the body will heal itself. That's why we call it natural medicine. So, let's review real quick. In orthodox medicine, which is called allopathic medicine, Draw my line back here. Their focus is disease. Now, if you don't have a documentable disease, it's usually a virus, or you married the wrong person, or something like this. So we give you things like anything to alleviate symptoms. And real popular drugs today, depression, Prozac, that type of thing, or any type of painkillers. So disease is the key here. And in some cases, when there's a documentable disease, it has to be dealt with allopathic methods. For example, if you need insulin and diabetes, this is very appropriate. If you have trauma, you have broken bones and they need to be set, this is very appropriate. If you're bleeding all over the highway, this is very appropriate. But if you're functioning but sick and your quality of life is no good, then natural medicine deals with dysfunction. Okay? And that's all those different things we drew up earlier, and we have to correct each one. For every single one of these things here that we find and we correct, your quality of life will get that much better. This is a very important concept, and I want you to understand this, because this is a focus of what we're doing in this clinic. This is the reason why we run a whole lot more tests than what you've gotten at your medical doctor's office, because it's easy to come up with the name of a disease. It's difficult to find out why that disease takes place. It takes a lot of investigation. Okay. With that concept in mind, we're just going to go right off into natural medicine here, and I want to explain to you how we go about finding this dysfunction we talked about. And we look at the triangle of health. If you look at the board again, the bottom of the triangle, or the base of the triangle, is structure. The structure is your bones, your joints, your tendons, the organs themselves, the fascia, all the different parts of the body that we can see and touch. This makes up 60% of the body. 60%. The other part of the triangle that's very important is chemical. Allopathic medicine, or orthodox medicine, spends 99% of their time here in the chemical aspect. That's what drugs are all about. Drugs are about changing the chemistry of your body. The last one is the electrical. And then I'm not going to talk about that a whole lot tonight, because that gets into acupuncture and homeopathy, and it's very, very complicated. So I'm not going to talk about it a lot. I'm talking about these two things here, chemical and structure. But these two combined together, this is about 20%, and this is about 20%. So 60% of the problems that we have wrong with our bodies are never really addressed in orthodox medicine. So as you can see, we're not going to leave 60% of your body out. We're going to talk about physical medicine here. And that's the first thing I want to cover, is the structure or physical medicine and why we address this. When you come into the clinic, we're going to examine you, and we're going to always do physical medicine, whether it's adjustments, whether it's some type of exercise, whether it's some type of physical medicine therapy, because it's important. Even if you have a stomach problem or something that you may feel is unrelated to the body as far as for the structure, it is part of the structure. A stomach is part of the structure, so are the intestines, so are the heart, so are the lungs. We can't just ignore 60% of the problem, and we're going to do that. I want you to take a look at this first slide. I'm going to explain structure to you. In order to understand structure, I want to go all the way back to when conception occurs. And conception, when the sperm and the egg meet, you just have a blob of tissue that's formed, and that's called a morula. And that morula looks like this. That's a picture of a morula right there. Now, this tissue is specially designed to do certain things as it goes along. And the very first thing that it's going to do is form the nervous system, or the computer of the body. And our nervous system lives inside of our skull and inside of our spine. And then the wires kind of go out from there, called nerves, and they control the whole body. So in order for the body to grow and develop as a child grows, the nervous system has to be formed first. And on this next slide, this is a picture of this, what we call the neural tube. This morula forms a neural tube, and then you can see on A where the tube starts to roll up on itself, and through B and C and D, where the tube actually forms a round tube and starts to form the nervous system, or the spinal column. On this next slide, you can actually see on A, this is a 22-day-year-old human being, and this is where this tube is starting to be formed, and it makes itself into a long tube. At 23 days old, your spine is basically formed. Now, if this opening you see on the left-hand side here on A does not close, this is called spina bifida. This is the #1 birth defect in the United States. And in 80% of the cases, it's caused by folic acid deficiency, which is a B vitamin deficiency. Now, if any of you ladies out there were pregnant, you know that most pregnant ladies don't even know they're pregnant till beyond the 23rd day. And you can see on this slide that if you have a folic acid, which is a B complex, part of the B complex deficiency, you will have a child with spina bifida, and these children are born when they can't use their legs and can't walk, and it's really a mess. A nutritional program is critically important. And of course, that's going to be one of the things we look at when we examine you and do lab work. Do you have any nutritional deficiencies? This next slide is an electron microscope picture of an actual human being at about 25 days old. 22 days, actually. The next slide, it shows you this neural tube completed, and you can see where different parts are starting to form. You can look at this slide and you can see where the head is starting to form, and little ears starting to form. And you see the little stubs coming out of the spine. These stubs continue to grow as the baby expands, and they grow out just like wires and a wiring from a house and a circuit box to every part of the body. It goes from the tips of the fingers and tips of the toes. I want to stop right here just for a second, go back to the board, and I want to draw this baby developing here. Okay, here's our neural tube, and you saw that on the slide. We saw the little nubs here coming out. You got a bunch of them. And as the baby starts to grow, put some eyes and ears on him, nose, there we go. The spine, or the cord here, little wires go out to all the different parts. There's little fingers and toes. These wires go out to each one of them, just like this. And in the middle section of the body, the wires go to different organs, like the heart, and the lungs, and the stomach, and the intestinal tract, to where the baby, when it's complete, it has a wire going to every single solitary part of the body. Very, very important. And we know this, maybe you never saw it before, but you've heard of people who've been in car wrecks, and they sever this cord, or they cut this like this, and what happens? They can't use that portion wherever that's been severed. And we all know people like this, and one that comes to mind is Christopher Reeves. He severed his spinal column right here, and he can't what? He can't walk, he can't use his arms. And the reason is this spinal column has been cut off from directing all the information to the rest of the body. So this is what it looks like. Now, that's covered by a spine and a brain, because this nervous system is very, very delicate, and you can't hardly touch it without it getting in trouble. If you've ever hit your crazy bone right here, all you have to do is barely touch this crazy bone, and boy, it really hurts. You can imagine just crunching down on it. Now I want to go back to the board here. I want to draw one more picture. What I'm going to do is I'm going to draw a picture of a spine, and the bones, just two bones, just like this. This is two of the vertebrae, and the nerve comes out here and it goes to different things. We talked about that. Let's just say it goes to a muscle, and it also goes to organs. Now, a lot of people have back pain associated with different conditions. People have stomach problems, have pain in their mid-back. People with problems up in their throat and lungs have pain in their upper back up in here. People who have female problems or prostate problems or digestive problems have pain in their low back. But you can also have pain from the structure being damaged too. And let me explain to you how this happens. You can have it one of two ways. Let me draw a line down the middle. You can have a problem in your spine where you've hurt the spine or damaged the nerve in some way, or hurt some part of the body which causes the spine to be out of whack, so to speak. And because it's connected to an organ and to the structure, which is a structure out here, it can cause problems. If you see here, if this nerve is being compressed or interfered with in any way by the bones themselves, it can cause problems out here. Okay? So you can have symptoms out in the muscles or the organs. The other is true also. And this is typical if you've gone to a doctor of chiropractic before and you get adjusted and adjusted and adjusted and adjusted, and it's good for 2 or 3 days, but the pain comes back. What's happening there in most cases is you have a problem out in the organs, and it's reflecting information back up the wiring system into the spine, and then the back pain becomes a symptom. So you can have symptoms in the structure of the body, or you can have symptoms in the back. Usually you have both. You may have a pain in your stomach and also have a pain in your back. How many of you ladies have pain in your back during your period? And what that is that's the uterus down here that's not doing well, it's not functioning well, and it's sending information back into the spine, causing the spine to hurt as a symptom. This is a very important concept also. Let's go back to our slides. And I want you to look at this slide here. This is a little baby. And now that you see this slide, you notice the spine, and you notice the little arms and legs starting to grow out underneath the head. You should understand at this point that there's little wires, like wiring or nerves, that come out of that spine, and it feeds all the parts of the body. And this is important because every part of the body knows what every other part of the body is doing all the time. Your fingernail knows what your lungs are doing. Your heart knows what your prostate is doing. Your toes know what your hair is doing because of this communication network of the nervous system, and it all goes through the spine and the brain. And in chiropractic medicine, we take a good hard look at the spine because the nervous system is there, and we want to make sure that it's operating properly. If it doesn't operate properly, you're not going to operate properly. But here in my clinic, and we practice natural medicine, we also take a good look at the organs and the metabolism because it also can have a major effect. Let's go on to the next slide. Now, what this is, remember I drew on my board a muscle, and you see those blue and red nerves coming down attaching to the muscle. And they just don't come down there and stick like a wire into the muscle. They break down. If you look on the bottom section of that slide, you see how the little wires are wrapped around every single fiber. What that is that's the nervous system that's going to contact every cell of the body, and that information is going to go to and from all the other parts of the body. Now, just for your own information, if you want to know why these basketball players and these other athletes get paid millions of dollars, and we don't get paid anything for playing basketball or football, this is the secret right here. They have more wires connected to their muscles than you and I do. And the more wires you have make you a better athlete. So they're just born with a better wiring system for movement than you and I. Let's go to the next slide and take a look at that. Now this is kind of a complicated looking slide, but don't get confused by it. I want you to see the brain up on the top of the slide, and you see the red and white wires coming down. Those are the nerves, and they circle around, and they go into this funny looking thing on the right hand side. That happens to be a stomach. You remember I also drew on the board that the nerves go to different organs. And this is the stomach here, and those nerves come out of the spine. They also come out of the brain. Now, the stomach, this is an interesting fact, but the stomach produces hydrochloric acid, which is a very, very powerful acid. And it would eat a hole right through a desk. It causes ulcers and causes other problems. And you all have heard this before. I'm producing too much stomach acid, it's eating a hole in my stomach, and I got an ulcer. So they, in allopathic medicine or orthodox medicine, what did I teach you a little bit earlier? What do we give? We give you the opposite of the symptoms, so antacid. See, hydrochloric acid. But how does your body know how much acid to make to digest the food and not burn a hole in your stomach? Well, these little taste buds on your tongue, they're not just for fun. What they are is they're neurological receptors. And when you chew, and when I say neurological, remember we're talking about the nervous system. When you chew your food, they chemically analyze what you're eating. And then they send a message down into the brain, down those little wires. It loops around inside the spine, comes out of the spine, goes into the stomach. And if you'll notice that insert there, the little red dots, where this shows you the lining of the stomach, they tell the stomach exactly how much hydrochloric acid to make to digest your food and not eat a hole in your stomach. It also tells the pancreas how much enzymes to make, how many enzymes to make in the liver and gallbladder and all the other things involved in the digestive process. So how important is the nervous system in the structure? Very, very important. And we want to make sure we address that issue, make sure that the structure has been taken care of, not just giving you a pill or a drug and just the chemistry. We want to do that 60% that no one else has looked at. Okay, let's look at the next slide. And this is just a slide out of a textbook to show you that this is not some medical secret that nobody's known about since doctors came around. This is very common information that all doctors, whether they're chiropractic doctors, medical doctors, or osteopathic doctors, we spend a lot of time studying this. We all have neuroanatomy and neurophysiology, and we know that this nervous system works like this. And you can see this slide. It says infertility, miscarriages, infections of the kidneys, urinary bladder, fallopian tubes, ovaries, and prostate are directly attributable to discompression of nerve roots. And what that means is if you have a problem in your spine and it is pinching down on a nerve, then it can cause these problems. It also will cause problems, that's just in the lower back. It also can cause problems with the thyroid gland, your esophagus, and your lungs, and your stomach, and your kidneys, and many other things in other parts of the spine. So what we want to do is make sure you understand that the nervous system is important. In chiropractic medicine, this is one of our main things that we want to address. Is your nervous system operating the way it should? Okay, that's basically the structure, and we're going to cover that in detail in your examinations and testing. You'll probably have more testing and a more thorough examination in this clinic than you will in any other clinic, because we're very, very interested in something that orthodox medicine doesn't do much of, and that is structural problems. Even if you don't have knee pain, we're going to check out the whole system. The next thing I want to talk about is the chemistry. Let's go back to our board. I want to draw our triangle of health again, and we have covered the structure, which is 60%, and we want to make sure. We want to make sure that it's all where it's supposed to be. We want to make sure there's no ducts blocked and the muscles are supposed to work like they're supposed to, and the tendons are working like they're supposed to, and we want to make sure all the bones are where they're supposed to be. The next one is a chemical, and this is a very, very interesting. Everything that happens in the human body is a chemical reaction. We really are a giant chemical manufacturing plant. Even moving your arm is a chemical reaction. Many, many chemical reactions have to take place. Everything we do is done by chemicals that are made up of vitamins and minerals and protein and carbohydrates and fats. So if everything we do is made up of the things we eat and the things that we take in our body, then it's very, very, very important that these things are done correctly. In addition to that, there are many things that interfere with the chemistry of the body that can cause problems, because these are very delicate operations that go on in the human body. And if you have something, for example, like a poison, it stops certain processes and then your body stops to function. We're all familiar with this, maybe not firsthand, but we've at least seen it in the TV or the movies, where, for example, you take a poison in and you die. Why does a poison kill you? A poison kills you because that particular chemical interferes with things in your body that have to happen in order for you to survive. For example, let's say that particular chemical you take in stops the liver from functioning or stops the heart from functioning. What happens? You die. So we want to talk about those different type of things. Now, when we look at that and we look at your chemistry, what I like to talk about is I want to break it down into something simple, and I call it my in-out theory and my out-in theory. And everything chemically in the body that happens can be broken down into two categories. Let's look up at the board. All problems in the human body from a chemical standpoint occur because something is in the body that should go out, or something is out of the body that should go in. Let me give you an example, then I'm going to go through a few more in detail. Something that's pretty common that we all have had happen to us in our lives is we stuck a splinter in our finger. When you stick a splinter in your finger, what happens? Well, it gets all inflamed and red, and then it turns white, and that pus forms. And then what do you have to do? Do we need laser surgery or IV antibiotics or hospitalization to cure this? Because that's an infection going on there. In fact, that white is the immune system of your body responding to something inside of your body that doesn't belong there, and it's trying to eat that thing, which is that little piece of wood, out of your finger, because it perceives it as being a danger to you. And what that white pus is that is your white blood cells that are killing themselves, and they're sacrificing themselves for you to try to remove that problem out. Now, let's assume we didn't go get laser surgery or anything like that. What do we have to do to cure this problem? Well, to cure the problem, we have to just take a pair of tweezers and take that splinter out. And we clean it up real good, and what happens? The body heals itself. And this is a good example of what we talked about, and this is the essence of natural medicine. Something is there that doesn't belong there. It's in the body that should come out. We take it out. What happens? You get well. Whether it's a splinter, or whether it's a toxic chemical, or whether it's something else that's in your body that should not be there, it's my job as your doctor to find it and remove it so your body will function well again. The other scenario can be something that's out of the body that needs to go in. Let's use an example of chronic fatigue. Let's say you just wore out, you can't make things go anymore, you can hardly get out of bed, and you go to a good doctor and he runs a proper test, which is relatively rare today in our setting, but we find out that you're anemic. And anemia is an iron deficiency. One of the types of anemia is an iron deficiency. And iron is responsible for transporting oxygen in the body, and we know that oxygen is important because we know when we stop breathing, bad things happen. If you don't have enough iron to carry enough oxygen, you're going to have extreme fatigue. So what is the cure for this? The cure is you put iron in your body by daily intake of iron. And when you do that, you're taking something that's out of the body that should go in, and then what happens? the body takes this, metabolizes it, incorporates it into the chemistry, and you get well. Our body is a self-healing, self-regulating mechanism. It only gets in trouble when something is in the body that needs to come out, or something's out of the body that needs to come in, or we've had some severe structural damage. But either way, this is still very important. All right, what I'd like to do now is take the first half of my theory, or my explanation. It's not really a theory, it's my explanation. And we're going to talk about things that are in the body that should come out. And this is what we do when you come into our clinic. We're going to start checking you for things that are in the body that shouldn't be there, and we want to remove them. Let's talk about some of the things that can be in your body that should not be there, that we need to identify so we can make sure this isn't disrupting that chemistry that I talked about. Let's talk about one. Let's talk about chemicals. We live here in Houston, Texas, and I don't think it's any secret that we have a lot of chemicals in our environment. In fact, bottled water has become very popular, and by the way, as my patient, I want you to be on reverse osmosis water or distilled water. I want you to stop drinking city water, and I want you to get on this type of water because it has no chemicals in it. We have over 300,000 chemicals in our environment that we know of, and we do not know whether we have the ability to detox many of these chemicals or not. We have tests, and if I feel necessary, we'll run this, and we can test the chemical pathways of the liver, which is your primary detox for chemicals, and that's called a P450 pathway in the liver. And we can determine whether you have a chemical exposure, and we have tests that we can also do to determine which chemicals that may be damaging the liver. Now, the liver itself, we know it's a big organ like this, but the chemical pathways that detox materials and chemicals, you can't see that. You can't do a pathological examination, in other words, an examination of the tissue and see whether this pathway is working or not. It's all done with tests of chemicals. So we need to find out if you have chemicals in your body that should not be there, and it's much more common than you think. We have over 300,000 food additives that are added to our food each year. We have many, many chemicals in our environment that we're exposed to. Some of the common ones we know about, like lead and benzene and things like that, but there's a lot of other ones too. One of the other things that we're going to look for is something that all of us do every day, and that's foods. This is a very complicated subject. Foods are chemicals. Nobody thinks of foods as chemicals, but they are. And not only do they have a chemical effect on your body in a good way, they can have a chemical effect on your body in a detrimental way. All of us have had the experience of eating certain foods, or maybe even foods that have been left out too long, and you have a stomachache. Well, that's a very mild form of a problem from a food. But foods can affect you very adversely. For example, we've known since the early 50s that rheumatoid arthritis, in 80% of the cases, is caused by food allergies. And this is a known fact in medicine. And the cure for that is to identify the food and remove it. And then the patient gets tremendous relief of the symptoms. Now, in the 50s, it was quite a process, and this is why it didn't become popular in medicine. You had to go in the hospital for 2 weeks and fast on water for 2 weeks, and then add one food at a time before we identified the food. And most people just said, I'd rather live with the arthritis, give me a pain pill. But it was done that way. Today, technology is going very quickly, and we